So the Exchange Network was set up in response to feedback that we got from patients and carers, and I think it was very important that they were able to tell us what they needed. I think they'd obviously seen things like events or meetings which can often feel very formal, and that they don't take advantage really of the different skills and experience that are in the room. In the past, often people were separated into different groups, so patients might learn together or researchers might learn together, and we actually thought that it was much better if we brought everybody together so that there's an opportunity to share experience. People definitely wanted something that was more collaborative, more connected, that gets underneath the surface of issues rather than just staying on the top of things. And it's about how do we build those skills and that confidence in the conversation about how we work in a much more collaborative way.
The Exchange Network is a really different meeting to anything I've been to before. It's facilitated really well. It brings together a really diverse group of patients, carers, the public, healthcare professionals and researchers. And it's a really safe space where you can ask any question and get feedback on your ideas.
It's a place that you come, you network, you meet different people. We don't wear our titles. We might at some point introduce where we come from, but it's all about who you are as an individual, what you have to offer, and everybody's opinion is valued.
You divide into groups. There's a facilitator. Every facilitator does it differently, and so you get to see how they think. But it provides you with discipline, but also a chance to intensify your thoughts on what you were doing. People hear you really well, and they can get out of you what you're seeking to get out of yourself.
I actually presented to the Exchange Network with a new idea and received some really valuable feedback. I've taken that idea and now have used it in my workplace, and other people have benefited from it as well.
It also shows me that my healthcare experience is translatable no matter what the project comes in the mornings that we look at.
You ask, you learn from it, and it helps to bring that more confidence in you.
Being more focused and also being able to use a method of asking questions and with confidence will eventually help their work within the health service.
You learn a lot about yourself, you learn a lot about how you're valued and things that you wouldn't normally see, and there's not very many environments that you can allow yourself to be vulnerable within. And I think that's what the Exchange Network brings. It brings the respect and the honesty.